Very good evening. Welcome to the programme with Gita Penze and me, Dominic Heald.
First tonight, a doctor's leader fears the healthcare system in Derbyshire will end up in chaos if a controversial shake-up approved recently is implemented.
Dr Peter Holden is a representative of the British Medical Association and a GP in the Peak District. He says he's speaking out because vulnerable elderly people in isolated communities are going to suffer.
NHS managers, though, insist the changes will work better than the existing setup. Our health correspondent Rob Sissons is in Bakewell. Rob.
Good evening. Yes, people here care very much about their local community hospital, which is threatened with closure. It's just up the road. It was the workhouse, so it's been here for as long as anyone can remember. Well, the shake-up, we're told, is designed to improve care. But the GP who tonight has spoken out, not because he says he's a moaning medic, but because he cares passionately about healthcare in this area, says he just wants to see the NHS locally think again. Dr Holden says the consultation in Derbyshire was a sham. Beds at the Whitworth Hospital near his Matlock surgery are going. And it was also decided last month that two community hospitals, New Home at Bakewell and the Bolsover Hospital, are to shut.
It's about saving money. Well, why not say so to the public? Why not be upfront? We are closing the community hospitals and people will be travelling further for care.
They say it's not about saving money, it's about improving care and bringing it closer to home.
The sentence of improving care and bringing it close to home is soft soaping the public. Of course people want to be treated in their own home, but when we are short of staff, and they have just closed a ward because they are short of staff, you have to be efficient and work in one place, not drive around in cars admiring the countryside for 80% of the time and only 20% of the time in front of the patient.
In Bakewell, there's resentment. New Home Hospital is to go.
It should remain as a hospital for local people.
I think it'll be sadly missed. I think it's a big mistake.
I went to New Home. One day I smashed me legs. I went to New Home and they were brilliant.
With it going, I think it's a disaster, really.
Your mum had rehab there. Was it good?
Yeah, amazing, because they did physiotherapy, she had everything.
GPs fear they'll be left picking up the pieces.
This is not work we can absorb in general practice. General practice is running ragged, everybody knows that. Everybody knows how difficult it is to get an appointment.
There's pressure on local NHS managers, but no sign at the moment they plan to do so.
So, Rob, some very forthright comments. What has the NHS had to say?
Yeah, people haven't been mincing their words today about this. It's not been implemented, these changes yet, of course, and we did want to put some tough questions to the NHS bosses, but we were told no one was available for interview today. They did give us a statement, and it basically said that they've rigorously debated a lot of these arguments, that they want higher quality care. This is what they insist this is all about, not money. And they say, quote, they welcome with open arms the input from GPs like Dr Holden that we've been hearing about today.
I gather the NHS organisation at the centre of this is facing mounting pressure.
That's right, Gita. We're talking about the North Derbyshire Clinical Commissioning Group, the CCGs as they're known. They have the purse strings. They decide the local spending priorities and where the money goes. There's a finite pot, as we know. And they're in a bit of a financial mess at the moment, and there's been a legal notice served on them, it emerged today, from NHS England, saying that they've got to get their act together quicker, and so there's going to be more developments, I guess, in the next few months.
OK, Rob, we'll leave you there. Thank you very much.